Coming up, we'll be on location at Hamilton Family Dentistry in Baltimore, Maryland, discussing the latest advances in dentistry and how they can improve your oral health and give you that beautiful smile you've always desired with one of this area's top dentists, Dr. Sidney Nolan. Welcome, Dr. Nolan, to the Top Doctors Interviews program.
Thank you. Thank you for having me.
Oh, it's our pleasure. We've got a lot to talk about. We're going to talk about different dental treatment options and some advances in dentistry. But before we get into that, I wanted to touch on your background a little bit. You're recognized as a top dentist throughout the Baltimore area. You're helping so many patients improve their oral health, achieve those beautiful smiles. We spoke to some of your patients. They love you. They love coming here. Tell me a little bit about your background and more about your vision for what you do here at the practice.
Yeah, I am one of those people. I've always known I've wanted to be a dentist. It's a weird fact about me. I have always been fascinated with how confident a smile can make a person, and that it helps with their personality and how they talk with people and feel about themselves. So I just wanted to go into the healthcare field and be able to give that confidence to people.
That's a great point, because people don't realize how important our mouth is. It's our gateway to our body, our oral health, and our confidence. Like if we have great teeth, we love to smile. Some of the patients that we interviewed said the same thing about your practice. They're like, we came here and they improved my smile, and now I feel like smiling all the time, which makes you feel better. It helps you with your job, your relationships, you're in a better mood. So it really affects every aspect of our life.
Yeah, definitely.
Tell me about some of the key treatments that you focus on here at Hamilton Family Dentistry.
So I do a little bit of everything. I can do things from fillings, crowns, bridges. I can do Invisalign. We treat people for Invisalign and do the clear aligner therapy. And then I can also do root canal therapy if somebody would need to get out of pain, or they have an infected tooth, or if a tooth is bothering them enough that they need to pull the tooth, we can pull the tooth together. We try to offer as many services as we can, so that way we can keep as many patients here and limit the amount of times that they have to call another office and schedule another appointment. And we just try to keep everybody here so they don't have to travel as much and work around with so many different offices.
That's a huge benefit to patients, because you don't have to refer them out. You build that relationship. You know their oral health better than anyone. And for a patient to come into one practice that does comprehensive dentistry is so much more comforting, because they have that comfort level and that relationship with you and that trust that you've built with them. So they don't have to go out to a new practice or a specialist in this or that. So it's great that you offer so much in one location.
We try to.
Let's touch on Invisalign. What are some of the benefits of Invisalign? How does it work compared to like braces, traditional braces?
So Invisalign, it's a little bit more hidden. They're clear aligners versus the metal brackets that you can see on your teeth. It's a little bit more work. We have to change the trays yourself at home every 2 weeks and keep up with it, and we see each other every couple of months to make sure teeth are listening. But it's more than just the cosmetic benefits with Invisalign. We are correcting the alignment of your teeth, so we're making sure your bite is stable and you're putting the forces on your teeth at the right angles. If we have a really narrow arch with our teeth and we expand that a little bit, you can actually breathe better while you're sleeping. So there are a lot of different benefits, more than just the cosmetic benefits with Invisalign.
That's great to know. I wish Invisalign was around when I had to wear braces, because I had the wires and all that was not fun.
Yeah,
for sure.
I agree.
And then the technology. Tell us about like the oral scanners and things that go along with Invisalign.
Yeah, pretty much everything is digital. We take a lot of photos beforehand, so then that way I can see your teeth and your smile from every single angle. And then we take a digital scan, we send that through Invisalign. I come up with a game plan to shift your teeth into the best position that they need to be. And then they send us the trays and we get started. There's not a lot of impressions or molding like it used to be whenever I had braces, and I'm taking the impressions and watching everybody around me gag on the impressions. There's none of that anymore. It makes it a lot easier for patients and us too.
What are the results like with Invisalign? Are they similar to braces?
Yep, it usually takes about 12 months, give or take a month or two. It just depends on the positioning of the teeth that we're starting with. But they can do all the movement that braces can do. Sometimes there's restrictions with how much movement we can do, but it essentially can do the same thing.
That sounds like a no-brainer for sure. Tell us about root canals, because I know that was something that people feared more than almost like death and taxes, right?
Right.
Getting a root canal.
Right.
But it's come a long way. It's not like that anymore.
Yeah.
How's that procedure performed?
They're pretty quick. Come in, we get you completely numb. We have the option of sedation if you wanted to be sedated or have laughing gas on top of it just to mellow things out a little bit. But it's definitely not as traumatizing as it used to be. It's a pretty quick procedure. It's essentially an extra step that we need to do. If the nerve is infected, the tooth is infected, it's an extra step we need to do to make sure that you can keep that tooth long term and use it for function, smiling, everything that you need to use it for.
Yeah, saving our natural teeth is always best if it's possible.
Yes.
Then that's a great option. But if unfortunately it's not in many cases, so there's other options that you guys offer, right?
Yes, and so if we're in the situation where a tooth can't be saved, we would look towards the route of taking that tooth out and preparing it for an implant long term, and that's a service that Dr. Wolfson can provide. So we can work together. I do the root canal, she does the surgery, and we work together well that way.
That's a great team effort, working together to make sure the patients get everything they need in one location.
Yep.
And Dr. Nolan, you also do cosmetic dentistry here, such as veneers. Can you tell us more about that?
Yep, I did a course in New York City that primarily focused on veneers and shaping teeth to fit to a person's face and their smile line, and it's a really great option if that is something that has bothered somebody. They look in the mirror and a tooth is just a little bit crooked or a little bit chipped, and they want to make that little tweak to make it perfect. A veneer would be a great option.
Who's a good candidate for veneers? Is it anyone, any age, or are there restrictions?
Pretty much. I mean, anybody that wants to make tiny changes. They don't like the shape of the teeth. They think they're a little too round or a little too square. They want to brighten their teeth. They've tried the whitening options and they're just not getting to that shade that they want to be. A veneer would be a good option. Sometimes people have chipping across the edges of their teeth and they just want to make sure that they stay smooth and they don't chip further. A veneer would be a good option.
Dr. Nolan, say a patient wants to contact Hamilton Family Dentistry and become a patient. What is the new patient process that they can expect?
So whenever we bring them in, we look at everything. We're taking photos, we are measuring their gums, we're taking x-rays, we are looking at every aspect of their mouth and making sure that if there's anything that we need to talk about, we can talk about it. We usually show them pictures of anything that they need to take a deeper look at. I want to make sure that they leave here without any questions. I want to make sure that they feel comfortable, they 100% understand why we're doing treatment, why we're talking about doing this treatment, why it's necessary, so that way they feel more confident coming back to actually get the work done.
It's really a partnership with each patient, and it's truly a patient-centric approach because you're really putting the patients first. You're not trying to sell people treatments that they don't need. Unfortunately, we see that in society. Nowadays, you're really top dentists here that really care for the patients. And that's why they get these great results. They're really happy with your practice, and they refer their family and friends.
One of the best parts of having a new patient is just listening to what they have to say and listening to what their concerns are and addressing those first, and then the rest will fall into place.
That is a great approach because we feel like as patients, whether it's medical, dental, that we're not really listened to. We feel like we're told stuff, but it just doesn't make you feel like a partnership, which it should be. So keep up the great work.
Yeah, thank you.
All right, and thank you so much for joining us and being a guest today on our program.
Yeah, thank you so much for having me.